Well, good morning. My name is Sherry Adams, and I'm the Executive Officer for Southwestern District Health Unit. And we have been in serving our community since 1945. So last year was our 75th anniversary, and we had great ideas and great expectations to celebrate, but then COVID hit. So I'll talk a little bit more about that in the slides, but welcome. So many of you before this last year might not even known what public health was. I'm sure you've heard a lot more about it with COVID coming into everybody's life. But public health has been around for many, many, many years. Even our public health unit, as I said, has been around for 75 years. So what is public health? These are activities that can ensure that our communities and our state and our country are safe and healthy. We do all sorts of events and efforts to identify, prevent, and combat any threat to the health of the public. Public health, as I said, has been around for centuries. Some really big achievements of public health has been the incorporation of vaccinations. You've heard a lot about vaccinations over this last year with the upcoming vaccinating program of COVID-19. But I was of the generation where I lived through a lot of the diseases. So having had measles, mumps, chickenpox, rubella, all of those diseases, that vaccinations weren't prevalent in my time frame. This was a huge accomplishment. So I am a true advocate for vaccinating, as it has helped to eradicate or at least control the spread of many diseases. Public health has also helped with improving sanitation, going from the old outhouse type scenario to current sanitation rules that we have now. We have a lot fewer deaths from heart disease and stroke and other diseases that we've not only identified, but found prevention and care for throughout the years. Another of our priorities is making it healthier for mothers and babies. The death rate and mortality rate of having a baby nowadays is a lot lower than it used to be in previous century. We also have had a reduction in tobacco use, which has thus decreased the number of lung conditions and helped some of those individuals live longer lives. So public health has been there in the past. We're also there in the present. We've got some big threats that we've not only seen recently, but there's also that continuing idea that we're going to constantly have threats going forward. New threats with chronic diseases. New things are identified every day. H1N1, which was prevalent in 2009, which was a pandemic then. Adding to that is COVID-19, which has really encompassed and surrounded a lot of our lives. And for you as new commissioners and new county employees and such, these kinds of scenarios really have a big role in your jobs as well, working with some of the partners that you're going to have to be tasked with and being in the front row seats for some of these diseases and helping make some of those decisions is going to be very critical. And this last year, throughout the United States, but even North Dakota, natural disasters continue to happen. And there is not a natural disaster or any kind of disease outbreak that public health does not have a role in. There are 10 essential public health services. I will not read those to you, but if you look kind of through these categories, basically it's the health of the community, it's diagnosing any problems of health hazards, education. Our role with education with the community is very huge, and bringing those different partners together. One of the roles that public health has especially played over this last year with COVID is partnership building. You may not be aware, or you might be more aware now, of how public health works. Public health was put into place by Century Code, requiring every county in North Dakota have some access to public health. Those counties with public health, can either be a district, such as what Southwestern District Health Unit is, as we cover the 8 counties in the Southwest. If you look at this map, the outlined areas in the whole western side, we are made up more of districts, multi-county health district. So we encompass quite a few counties. You see some in blue that are just a single city-county health unit. You see some in green that are also single county health districts, and some in red, which are single county health units. So we have 28 health units and districts in North Dakota. And commissioners and auditors play a huge role, not only just in supporting the public health, because through mill levies and some of the other things that we have to come forward with part of our budget, but in some instances, commissioners also are a big part of the ruling board of their public health. As part of public health across North Dakota, we also have environmental health. So we are responsible for all of the inspections, whether it's bars, restaurants, schools, daycares, all of those kinds of things. Several of us have water testing labs, but we're also responsible for, making sure that the drinking water, the swimming pools, hot tubs, all of the wells, the septic systems are all working and properly, and being in charge of making sure that anything that has to do not only with the environment, our air, our water, and our soil is working properly. And we do a lot also of education in the summer for mosquito and vector control for West Nile. North Dakota has a very high level of radiation. We have a high level of radon, and so trying to get education out there and telling people what to do if they have high levels of radon. And then we just do general environmental health and education. Public health also is one of the resources for the Women, Infant, and Children program. So this is the nutritional information program for children under the age of 5, up to age 5. Tobacco prevention also is a role of public health. That's a role of all healthcare professionals. We try to educate the community on the risks of tobacco. Vaping has become a really difficult problem, and so our tobacco prevention control program also is able to help with those cessation programs, with resources, to help individuals that are ready to quit smoking to have the resources to do so. One thing that's been relatively new for public health over the last couple years, probably about 3 or 4 years, is incorporating behavioral health. This is usually under human services, but we're finding that a lot of what public health does actually works very closely with behavioral health. And probably the biggest program that we have, of course, is the nursing program, which encompasses pretty much anything from baby to the oldest person that can walk in the door. So our nurses are cross-trained in many, many areas. Primarily, nurses do a lot of immunizations for all diseases that are out there. Public health also works in collaboration with a lot of the hospitals and do postpartum visits for new mothers. We also do health tracks, which is for individuals or kids, quote unquote, up to the age of 21 that don't have insurance, and so helping connect them with some resources and some health screenings. Health maintenance is a program for individuals over the age of 60, and it is a federally funded, quote unquote, state funded, quote unquote, mill levy funded at the local level program for individuals. And those are things that offer blood pressures, vaccinations, and such for our elderly. And then Women's Way is a program for women that do not have insurance that can get in for mammograms and other women's schedules and screenings. So the biggest thing I want to mention to all of you is that as commissioners, as auditors, as new people coming into the county, the thing that's going to be really important that we have learned over the years is it's all about collaboration, partnerships, and networking. And so I think it's really important as new commissioners to find out who your public health people are, to work with them, and to be able to support them when they need to have your help. And a lot of times we will have to have your help we are allowed a 5 mil levy request to help support some of the programs that are out there that are not funded but required to happen. So thank you very much for your time. Thank you for what you're doing. Thank you for being the example for your communities.